Hello from Practice and Research Together. Today's part talk is titled Strengthening Kinship Care in British Columbia, Leveraging Research and Advocacy for Comprehensive Supports for Children, Youth, and Families. Today, our guest presenters are Dr. Barbara Lee, Sherry Monsma, the President of Fairness for Children Raised by Relatives, and Gail Moliette, the Vice President for Fairness for Children Raised by Relatives. Please take it away.
Thank you. I'm just going to share my screen, so give me a moment. There we go. Right, so thank you so much, Sarah. My name is Barbara Lee, and our part talk is called Strengthening Kinship Care in British Columbia, Leveraging Research and Advocacy for Comprehensive Supports for Children, Youth, and Families. And we'll be sharing about our community-engaged research and advocacy work with you today. Oops. Okay. So again, I'm Barbara Lee, and I'm an assistant professor at UBC School of Social Work, and also the co-director for the Center Study of Services to Children and Families and a Knowledge Mobilization scholar. And I'm joining in from the shared traditional, ancestral, and unceded territories of the Musqueam, Tsleil-Waututh, and Squamish people.
My name is Sherry Monsma. I am a 70-year-old widowed grandmother of two and grandmother of four and great-grandmother of two. I've been raising two of my grandsons over the last 16 years, and I'm also the proud president of Fairness for Children Raised by Relatives.
Good afternoon. My name is Gail Moliette. I'm the vice president of Fairness for Children Raised by Relatives. My husband and myself raised our grandson from 4 days old until he was 19. So we're actually past kinship care, though he does have a bed in our house at 20 years old.
Fairness is a nonprofit society whose members are all kinship caregivers who are either currently or have raised a relative or close friend's child or children. And all of our regular members and board of directors are 100% volunteers. We have come together to self-advocate for our kinship care children to ensure they receive the same rights, opportunities, and benefits as all other children in care in BC. In BC, it is estimated there are more than 13,000 children being raised by their grandparents or other relatives when their parents are unable to care for them due to reasons such as mental and physical health illness, substance misuse, incarceration, and even death. The majority of these children have experienced trauma and have unique needs. Approximately 7,250 of these children receive some kind of funding or support from MCFD. However, MCFD has 6 unique programs with different criteria and benefits. Unlike foster care, we as kinship caregivers commit to raising these children as our own. So there is no kinship care rights agreement with MCFD. There is no standardized maintenance agreements or 3-tiered financial supports for our children with disabilities. No standardized respite support, no previous medical history of the child, and no additional monthly funding for just agreeing to care for these children. There is no one to guide us through the endless day-to-day challenges of raising these children. Our families are thrown into the deep end with very little support and spend a lot of our time researching and advocating so we can find and implement the support needed for our individual children. It should also be noted there are now more children and youth in kinship care than foster care. Our research journey started when I was attending UBC United Way Public Policy Program and learned about the UBC Engagement Office. I reached out in early 2023, and in May of that year, Karen Chu, the manager of Innovation Partnerships from the Office of VP Research and Innovation, reached out to the Center for Study of Services to Children and Families about exploring a potential partnership in working with kinship care. She was invaluable in assisting us in preparing our research questions. It was at that time that we were introduced to Barbara Lee, UBC research professor, our incredible mentor and advisor who has brought us into the world of research.
Yeah, and so UBC and Fairness has been working together for over a year, and it has been It's such a pleasure. When we first got connected, I was just so infected by Sherry and Gail's passion and commitment for kinship caregivers and their children. And as we continue to meet, and I was thinking about how to be able to support fairness in engaging in research and using empirical based evidence to inform their strategies and policy advocacy. We had no existing resources, no secured funding yet. And I was thinking about the Master's Social Work Program Evaluation Research course that I teach annually as a potential site for expanded partnership and research collaboration. And this MSW research course, it's supported by and sponsored by the Ministry of Children and Families Development. And so MCFD proposes research topics, and over an academic year from September to April, students engage in applied research to learn and also contribute to research for MCFD. So I've discussed expanding the partnership to UBC, MCFD, and Fairness, and surprisingly, everyone was on board. And Fairness saw it as an opportunity to help inform MCFD of the needs of kinship caregivers and their children. And MCFD was open to leveraging the expansive kinship caregiver networks through Fairness to understand how to make system changes within their ministry.
It was an amazing learning opportunity to co-sponsor the UBC social worker master students in their research course. This collaboration provided opportunities to build relationships, not only with those we worked alongside, but also to get connected to others in higher positions within the policy and operations departments in MCFD. Our continued relationship with Barbara has provided us not only with our first research paper, but she has also assisted in applying for and receiving a UBC CUES partnership grant. This grant has made it possible to work on a second research project related to the feedback of over 30 fairness members into the 2022 MCFD Child and Family Legislative Review.
So this research was conducted by 3 MSW students, and I want to give acknowledgement and recognition for their work. Angel Thomas, Gerardo Gonzalez, and Grace Pegg. And the research questions that they posed was one around child youth support needs. And we asked, what are the identified needs and supports by kinship caregivers for their children and or youth in their care? And what are the identified needs and supports for children and or youth in their care who might have complex trauma histories? And then we also asked about caregiver well-being. What are the identified needs and supports by kinship caregivers for their own mental, physical health, and overall well-being while raising the children and our youth in their care? And I'll talk about the research findings, but we had also published the findings in an open access e-journal that I founded called Research and Evaluation in Children, Youth, and Family Services. So in terms of the research findings, it highlighted 2 primary themes, one around complex demands of caregiving and also to caregivers feeling alone. So in terms of complex demands of caregiving, coping was one of the sub-themes there. And this represented the sentiment that caregivers really expressed frustration that they could not provide the care that they wanted due to a multitude of barriers and discrimination against them from the child welfare system. And caregivers identified that they really could benefit from counseling, respite, educational workshops and training, and a whole host of other social services. And in assuming care of kin, this really impacted their core and extended family members and complicating family relational dynamics and having a greater impact on the broader family. And also the need for assessments. There's high rates of complex trauma and mental health issues among children, youth, and caregivers really need further assessment and consistency on mental health or developmental disability supports to be able to raise their children. Within the theme of caregivers feeling alone, The majority of caregivers in the study were older adults, dominantly female identifying, and rather than retirement, they're caring for children again and putting them in a different life stage than their peers. And this contributed to them feeling alone and like an outsider. And not only did they express feeling like an outsider to their peers, they felt like an outsider within the child welfare system, as there's noted disparities in resources and recognition around kinship caregivers versus foster caregivers. And ultimately, the caregivers didn't feel equipped to raise children with complex trauma. They expressed a need for continued training and support. But despite all of these different adversities and challenges it brings, caregivers identified feeling rewarded and blessed as being a caregiver.
In the process of exploring research topics for the MSW students, I shared the information that was collected as part of the MCFD community consultation for transforming the child welfare system and developing Indigenous jurisdiction. We believe there was a need for this incredibly rich source of data to be shared more widely. So we discussed turning the information into a formal report for fairness to have and use. We applied for a UBC Community University Enhancement Support Grant, where we expanded the work to include strategic advocacy planning, which would outline and sustain capacity building for fairness to continue this work. This funding was also allowed us to video record some of our members' stories, which we are looking forward to screening publicly in February 2025.
As part of the research, it was found that isolation is a big part of the kinship caregivers' experience. Fairness has been hosting annual face-to-face gatherings with kinship caregivers, which has been a great success every year. The research also highlighted the financial constraints and needs for respite for kinship caregivers. We provide the safe place for no or minimum monetary cost to them. This year, Embracing Our Diversity gathering on June the 8th in Abbotsford, BC kinship caregivers from across the province gathered to network. It was a weekend full of sharing their stories and learning about trauma-aware communications during a fantastic workshop by Kate Toy, self-compassion coach. Through lots of tears and some laughs, and within a group who were also experiencing similar grief and trauma that their families were experiencing. Minister Laws sent us a video to share with our members to thank them directly for what they do, as well as show her support for fairness in the gathering. Having our kinship caregivers being validated and thanked is important, not only from the minister, but from others in the community and extended family members. This year, Fairness worked on providing our members during the gathering with easy to understand breakdown of the various elder care plans available to kinship caregivers. Strange as it sounds, it was the first time a lot of the caregivers had seen this type of document. Even though many had been on the elder care plan for many years, these documents are available on our website. Our gatherings are extremely important for the kinship caregivers and will continue to be a vital part of what we do.
In closing, I would like to share some of the themes that have emerged from our secondary research report and will be integrated into our strategic advocacy plan. Fair support for all, early help, better outcomes, legal rights for kinship, financial equity now, respect Indigenous ties, boost our social workers, and caregiver respect matters.
Thank you for this opportunity to share with you. Here's our contact information and website for Fairness for more information and to stay in touch.
Thank you both all so much.